Well, as I mentioned earlier, there are concerns that South Africa is losing its momentum in the vaccination drive. There's been a drop in the number of people getting vaccinations since the beginning of August. Now, even though the country is securing more vaccines, not enough people are getting the jab. And I'm joined now by the Department of Health's Deputy Director General, Nicholas Chris. Dr. Chris, thank you so much for joining us. I wonder if we could start by you just telling us what is the latest on the vaccination numbers. I'm wondering how the weekend went and if you've got any news from how Monday has gone.
Yeah, good evening, Sally. Good evening to the viewers. Indeed, the vaccination numbers have slowed down, and it's concerning that it's slowed so much. This past weekend was not very good at all. I just looked at Sunday's figures, was 10,500, which is pretty slow even for a Sunday. And today's figures, last I saw it just on 2 o'clock, and it was about 150,000 at 2 o'clock. So hopefully it'll pick up a bit more. The final figures for the day will be better than that. But we should be by now over 250,000 a day. We have vaccine, we have the capability of vaccinating. We have a lot of people who need to be vaccinated. We've got a lot of different initiatives that are targeting outreach clinics, mass vaccination sites, private vaccinations in pharmacies and other sites. There are a lot of public clinics that are vaccinating. So there are a lot of initiatives, but they are all reporting that they are not full, and they could be seeing a lot more people.
What do you think is going wrong?
Look, I think it's complicated, and part of it is that we lost a bit of momentum in the week that we didn't have vaccine at all clinics, and it was a little bit difficult for people to get to sites, or a bit irritating for them to get to sites and then be turned away. So the public were frustrated during that week. I think that's part of it. The other is that there's, in a way, a bit of vaccination fatigue. People we're out of the third wave in parts of the country, and people have relaxed their guard a bit. I think also that there is some hesitancy. People wait and see. There's a lot of noise by anti-vaxxers who can't see the obvious evidence that vaccinations save lives. We are very clear, and we can see our health workers have been very well protected by the vaccinations. Very few of them have got sick, never mind acutely ill. And as we've heard from some of our eminent practitioners in the services, they haven't seen any health practitioner in ICU for a very long time. So those are all encouraging things that tell us the vaccine is safe, it's effective, and it does prevent you from getting severe illness and from dying. But people are nonetheless still sitting on the fence and waiting to see what happens.
So talk to me about that week we lost momentum. Why was there no vaccine? Who was meant to supply vaccines for that week?
So a number of things happened at the same time. The one is that we get weekly deliveries of Pfizer vaccine, and in that week, the delivery we got was nearly 600,000 doses smaller than the usual Sunday night deliveries. And we were expecting Johnson & Johnson vaccine at the beginning of the week, and there was still some further delays. You will recall that there was this global problem with Johnson & Johnson vaccine, and then getting that supply line going again all around the world has been slower than anticipated. And we lost out on a whole week before we received that vaccine. So it was just a confluence of just bad delivery dates in that week.
I'm well aware of the problems that Johnson & Johnson have had, and there have been really awful delays that were human error, that sort of problem. There's a very interesting article from the New York Times that I want to draw your attention to. It talks about, it says Johnson & Johnson's COVID vaccine was supposed to be one of Africa's most important weapons, agreed to sell enough of its inexpensive vaccine to inoculate eventually a third of the continent, but this has not happened. And this is really where I want your response. This is from the New York Times, the article I'm referring to. It says South Africa is still waiting to receive the overwhelming majority of the 31 million vaccine doses it ordered from J&J. It's administered only about 2 million. At the same time, Johnson & Johnson has been exporting millions of doses that were bottled and packaged in South Africa for distribution in Europe. This is according to Johnson & Johnson, the South African manufacturer Aspen, as well as the South African government. Now, my question to you is part of the vaccine problem from that week, because there were more doses leaving the country from the Aspen factory from Johnson & Johnson than were actually being supplied here, or are you not aware?
No, we were very well aware. We were in contact with both Johnson & Johnson and Aspen at the time, and no vaccine left the country during that time. So, and I think that was a frustration for everybody while we were coming to grips with it. I think Johnson & Johnson will still be a major part of Africa's total vaccination program. I think as a company, they can speak for themselves, but they lost a lot of momentum in their manufacturing capabilities during that long period that they were unable to release any vaccine. And getting all their plants up and running again is obviously an issue that you would need to discuss with them. But for our part, speaking for South Africa, we have we obviously got the first Johnson & Johnson vaccine as part of Sisonke's study, which is about 500,000 doses altogether that have been administered. Then we got the 1.5 million short expiry date vaccines that have all been administered, mostly on specific public sector essential services programs. Some of it went into community services now towards the end. And then we've received 1.5 million doses, more or less, in this recent delivery that was a little bit delayed, and the next delivery is due. In fact, I think it has actually already arrived. So as far as South Africans are concerned, we get what is due to us, but we have understood all the time from Johnson & Johnson that their entire delivery to Africa and all their other clients is based out of Europe. And to do that, wherever they are finishing and filling in the world, they take the vaccines there for their export distribution. So I'm sure it is more complicated than meets the eye.
I suppose what I want to check, and I understand that obviously Johnson & Johnson, it's supplied, the basic ingredient is supplied from Europe, so they'd want some of that back. I want to know from the health department if you are comfortable with the split of what is leaving the country in terms of the Johnson & Johnson vaccines and what is staying in South Africa.
Well, as far as, look, there are agreements on this, and we are aware of what is in the agreements. Obviously, they're between Europe and Africa and ourselves as a country within Africa. And we have been satisfied with what they have told us. Over time, we will see whether everybody sticks to what is in the agreements, but we are satisfied that the total number of Johnson & Johnson vaccines that have been committed to Africa are what they have agreed to.
All right. Now, according to this article, and I am quoting an article written by the New York Times, so this is not my own work, but they're saying the South African government export records have been seen by the New York Times. They don't say how much has left the country. Are you aware of what the split is? I'm hearing that it could be a sort of a 60% split, 60% to stay in Africa.
No, I'm not sure what the actual final agreement is. I know what the number of doses was that was committed to the African Union, and that was what it was about, number of doses. How fast and how big the capacity is in Aspen as one of their finish and filling plants is between Aspen and Johnson & Johnson.
All right. I want to just finish off on this issue of vaccine hesitancy and the anti-vaxxer movement. I think many of us in South Africa just didn't think it would be such a problem. Have you been able to quantify how much of it is hesitancy and just not knowing enough because it's a new virus and therefore a new vaccine, and how much of it is really a strong anti-vaxxer sentiment that's taking hold? Because that's very difficult to argue with, because people are not interested in the facts, clearly. Otherwise, they wouldn't have that position. Yeah. So have you been able to sort of slice and dice where the problems are coming in and how you're going to address it exactly?
Yeah, so there have been a number of social studies done from different sources that we've seen, and it seems that it's definitely less than 10% of the public, of the adult public, who are what we would regard as anti-vaxxers, people who are dead against vaccination for either religious or other reasons. So that's only 10%. That means the remaining 90% are either hesitant, listening and wondering what's going to happen and watching and waiting and seeing, or they are highly committed and have already been vaccinated. But what we can tell the public, and if I can address the public and say to them, we know that vaccines save lives. We are very clear that there's sufficient data on that. We also know that vaccines are like any other vaccine, do have side effects, and we do know that adverse events are reported. We do know that during the course of this week, the information on adverse events are going to be made public in a public website and will be constantly made available by the independent regulator so that everybody can see in a transparent manner and understand what is going on. But the numbers of adverse events that happen are minute compared with the complications that we are seeing from COVID infection. We know that COVID infection is bad. We know that for older people in particular, it can be life-threatening, serious diseases, and it can kill you. And we know that that is not what the vaccine does to you. So we would like to appeal to the public, look at the facts, consider the testimonies of the many people who are telling us about their personal experiences in hospital and of friends and family of theirs who were not vaccinated, who got into serious trouble and or died, and then make the decision to come for vaccination. We have enough vaccines and enough people more than willing to vaccinate you.
Yeah, and, you know, to emphasize what you've just said, Dr. Crisp, 299 deaths reported in this latest cycle. The numbers are just in. 7,983 new cases, but those deaths are still extraordinarily high. And if we look at countries such as the UK, where they have a high vaccination, that link between being infected and ending up dying has been absolutely broken. I suppose the last thing I want to ask you is, we're all aware of the Digital Vibes campaign. We know that that campaign was eventually morphed into a COVID-19 campaign. There should have been comms about that. Is that why we're not seeing big billboards with our top stars and our top influencers proudly saying they've got the jab? Because that's the sort of thing that surely is going to make people stop and think.
Yeah, well, I don't want to comment on Digital Vibes for obvious reasons, but I do want to comment on what we are doing. So there's a very big effort being made between the Department of Health, together with the Government Communication Services, the GCIS, together with a substantial input from the Business for South Africa, supported by the Solidarity Fund, to put together the necessary messaging, the formats of messaging, other means of getting across to the public exactly what is going on, how the program is structured, and generally communicating. We do know that members of the public don't all hear the same messages in the same way, and we do know that we who are older people maybe listen to the radio and the TV more and don't pay much attention to social media and so on. So there are a number of different strategies that are going to be required, different targeting methods for different communities. We've had a meeting over the weekend with all our provincial counterparts, both the heads of departments and the members of the executive councils, to listen to them about what they're experiencing on the ground. And I believe you're going to start seeing a lot more coordinated effort and communicating with the public of what's going on.
All right. Well, thank you so much for your time this evening. Much appreciated. Department of Health Deputy DG Dr. Nicholas Crispin. He's telling us that as of 2 p.m. today, 150,000 vaccinations had taken place. Of course, it's still below the 250,000 a day they're absolutely capable of, but there were still a few hours left in the day, so maybe that figure has gone up. But weekend's still a concern. Only 10,500 vaccinations on Sunday.